Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hey everybody, this is Nitin Choda with InTouchEMR.com, and in this video I'm actually going to tell you a little bit about the therapy cap and the KX modifier. There are a lot of myths and misconceptions about the therapy cap and the KX modifier. A lot of EMR systems will tell you, yes, we can keep track of the therapy cap and help you trigger the KX modifier. Now, I'll be honest with you, it's almost impossible to keep track of the therapy cap in real time. Here's why. On the Medicare website, you can actually find out the therapy cap of a particular patient. I don't know if you know this, but you can. On the Medicare website, there's an actual link on Medicare where you can determine what the therapy cap is and how much of the cap has been reached for that particular patient. Now, the therapy cap is obviously, at the time of writing of this, at the time of filming of this video, it's $1,900. That's what the therapy cap is. However, what's important for you is to know how much of the cap, as in how much of the cap has been hit by that particular patient. So there's a question mark as to, how much of the cap has been hit, and that's, that's what this video is about, to help you determine that. On the CMS website, you can actually determine how much of the cap has been hit, but, and there's a big but, that information is a few weeks old. So you don't know in real time what the actual therapy cap situation is for that particular patient. Now, let's assume even if you did know, maybe you called Medicare or were able to acquire that information. There are ways to be able to do that. Let's assume you did know what the therapy cap information is. Even if you track it within the EMR, let's say you track it and the EMR starts deducting the amount from the cap based on the charges that you create, you still don't know whether the patient is going to some other provider for treatments or whether another provider is billing that particular patient and then the therapy cap is reducing. So if a system allows you to keep track of the therapy cap, I mean, that's not necessarily a bad thing, but that's not really accurate. You as a practice should at the minimum have the ability within the system to just turn on the KX modifier. So your system should just say KX modifier on or off. And then once you turn the KX modifier, let's say on, then your system should automatically, the EMR system, should then apply the KX modifier to the amount going forward after the $1,900 therapy cap. But again, let me just clarify the misconception surrounding the therapy cap. There is no way to determine the exact percentage or the exact amount that the patient has hit as far as the therapy cap is concerned, or how close to the cap they are. There's no way to know that in real time until you actually, perhaps find out directly from Medicare. So even if a system tells you, yes, we can keep track of your therapy cap, you should be a little bit forewarned, because that's not really, because there's no way for a system to know what's happening outside of the system. And so you should be aware of that, and therefore, I think, in my opinion, the best gauge is the Medicare website combined with you getting real-time information from Medicare and from the patient to know about the therapy cap. But at the bare minimum, your system should allow you to turn on or turn off the KX modifier, and that's a better way to keep track of the therapy cap. Thank you so much for watching. Make sure you go to InTouchEMR.com for a demo of how we can help you keep track of the therapy cap, and more importantly, visit our website and ask for the executive briefing on the 5 blunders to avoid with EMR. Whether you choose to work with us or not, you'll get a lot of insight from that briefing. You'll be able to make your practice simpler, faster, more streamlined, more efficient. And with our system, InTouchEMR.com, you'll have a fast, integrated, and easy EMR to do everything in your practice, from scheduling to documentation to billing, and keeping track of the therapy cap, and then triggering the KX modifier to your claims is just one of the things that we are good at. Thank you so much for watching, and good luck, and I hope I see you for in the rest of the videos on this channel.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.